My research is largely, can be categorized as health services research overlapping with health economics. And in short, what that involves is the extrapolation of clinical research, specifically clinical trials, extrapolation of those results into what it might mean for healthcare in Australia and elsewhere as well. So, for example, a clinical trial might show that there's a promising new drug that could treat a fairly nasty condition. My research then goes on to look at what the potential impact of that drug is, and it'll take into account things like how common is that condition, how effective is this drug in the real world, and then lastly, how costly it is. And if that condition was also very costly, then we could potentially tolerate a costly drug to reduce the economic impact as well. So that's the kind of work that we do. It involves the combination of results from clinical studies with real-world evidence, real-world epidemiology, and we generate real-world evidence. And that's a catchphrase that is starting to gain a lot of traction in the work that I do. Career highlights in terms of my research. I've done, assessed the value of a lot of interventions, and many of them have been taken on board by the Department of Health and implemented. So in Australia, we're very lucky to have a universal healthcare system in which healthcare is provided by and large free of charge to people. That makes us quite a lucky country. However, there is a need to assess in a scientific way which of these healthcare interventions should be funded under our universal healthcare system. And that involves a fair bit of science. And I've been lucky to be involved in research that have assessed a lot of these healthcare interventions that have been shown to be of value and then hence been made available to Australians. And I like it when I see a healthcare product that I've been involved in putting onto the formulary, for example, and that's made available to people. It generates good outcomes for people. So those are the kind of things that I enjoy and probably highlights that I've been involved in. I work, as mentioned, in the general field of health economics. And in the last few years, I've been really interested in assessing the impact and the value of healthcare interventions in terms of outcomes on productivity. And so this is the extent to which a particular healthcare intervention might get actually someone back to work and start contributing to the economy again. When we evaluate healthcare interventions, at least in Australia, we don't do this in any formal sense. More recently, I've been looking at and trying to quantify the impact on getting people back into the workforce and subsequently generating more economy from having people achieve good health. And this would help, is another sort of dimension to making decisions for healthcare funding. It's fascinating and I'm really enjoying it.